Right now, thousands of people are living with pancreatic cancer without knowing it. Not because the disease is rare, but because the early warning signs are often quiet, subtle, and easily mistaken for everyday problems like fatigue, stomach discomfort, or minor digestive issues. And by the time many people finally realize something is seriously wrong, the disease has already progressed much further than they ever imagined. Many serious diseases do not appear suddenly. They develop slowly and silently inside the body, sometimes for months or even years before a diagnosis is made. During this time, the body often sends small warning signals, signals that can easily be ignored, misunderstood, or dismissed as something harmless. In this video, we will explore 7 symptoms of pancreatic cancer that doctors say should never be ignored. Some of these warning signs may seem surprisingly ordinary at first, but when you understand what they can mean inside the body, they reveal important clues about what might be happening beneath the surface. Number 1. Persistent upper abdominal pain. One of the earliest symptoms many people experience is a deep, persistent pain in the upper abdomen. At first, this discomfort may feel vague. Some people describe it as a dull ache that appears after eating. Others feel a pressure or heaviness just below the ribs. What makes this symptom unusual is that the pain often spreads to the back. This happens because the pancreas sits deep in the abdomen, close to major nerves and the spine. When a tumor begins growing in the pancreas, it can irritate these nearby nerves, causing pain that radiates backward. Unfortunately, many people assume this discomfort is caused by common problems such as indigestion, muscle strain, or acid reflux. But when abdominal pain becomes persistent, unexplained, or gradually worsens over time, it can be a signal that something deeper inside the body requires medical attention. And for some patients, this pain is one of the first clues that pancreatic disease may be developing. But pain is only one signal the body may send. The next symptom often appears somewhere people rarely expect. Number 2, unexplained weight loss. Losing weight without trying may sound like good news to some people. But unexplained weight loss can sometimes be one of the body's most serious warning signals. Many individuals with pancreatic cancer notice that their weight begins to drop even though their diet and lifestyle have not changed. The reason for this is deeply connected to how the pancreas works. The pancreas produces enzymes that help break down fats, proteins, and carbohydrates during digestion. When pancreatic function becomes disrupted, the body may struggle to properly absorb nutrients from food. As a result, even normal meals may no longer provide the nourishment the body needs. Over time, this can lead to steady, unintentional weight loss. In addition, certain cancers can alter the body's metabolism, causing it to burn energy more quickly than usual. Because weight changes can happen gradually, many people ignore this signal until the loss becomes significant. But unexplained weight loss is always something doctors take seriously. And sometimes, the digestive system itself begins sending additional signals that something is wrong. Number 3, digestive problems and loss of appetite. Another early sign of pancreatic trouble often appears during meals. Many people begin noticing unusual digestive discomfort. This may include bloating, nausea, feeling full after only a few bites of food, or a sudden loss of appetite. Some individuals even develop an aversion to foods they previously enjoyed. This happens because the pancreas plays a central role in digestion. When the organ cannot release enough digestive enzymes, food may move through the digestive system without being fully broken down. This can create a sense of heaviness, discomfort, and poor digestion after eating. Because these symptoms resemble common stomach issues, they are frequently dismissed as temporary problems. But when digestive discomfort becomes persistent and appetite continues to decline, the body may be signaling that something deeper is affecting the digestive process. And sometimes, the next symptom appears in a place many people never associate with the pancreas. Number 4, changes in stool. One of the most overlooked warning signs of pancreatic disease appears in the bathroom. Many patients begin noticing unusual changes in their stool. The stool may become pale, greasy, or unusually foul smelling. In some cases, it may float rather than sink. These changes occur because the pancreas normally produces enzymes that help digest fats. When these enzymes are not released properly, fat from food may pass through the digestive system undigested. This leads to stools that appear oily or difficult to flush. While this symptom can also occur with other digestive conditions, persistent changes in stool should never be ignored. They can provide valuable clues about how the digestive system is functioning. And sometimes, the body sends another signal that appears directly on the skin. But here is something that surprises many people. One of the most visible warning signs of pancreatic cancer can sometimes appear in the mirror. It may begin with subtle changes in skin color that seem unrelated to digestion or internal organs. Yet doctors know that when the pancreas is affected, these visible signs can appear long before many people suspect a serious disease. In fact, for some patients, this unexpected symptom becomes the moment they finally realize something inside their body is not functioning normally. And it leads us to the next warning sign. Number 5, yellowing of the skin and eyes. Jaundice. One of the most recognizable symptoms of pancreatic cancer is jaundice. This condition causes the skin and the whites of the eyes to develop a yellow tint. Jaundice occurs when a substance called bilirubin builds up in the bloodstream. Normally, bile-carrying bilirubin flows from the liver through the bile ducts and into the intestines. But when a tumor develops in the head of the pancreas, it can press against the bile duct and block this flow. As bilirubin accumulates, it begins affecting the skin and eyes. Many patients also notice dark urine, pale stools, and intense itching. Because jaundice is visible and difficult to ignore, it often becomes one of the symptoms that finally brings people to medical attention. But long before this stage appears, another warning sign may already be developing quietly. Number 6, sudden onset of diabetes. For some individuals, the pancreas sends a warning signal through blood sugar levels. Doctors have observed that pancreatic cancer can sometimes trigger the sudden development of diabetes, especially in people who previously had normal blood sugar. This occurs because the pancreas produces insulin, the hormone responsible for regulating glucose in the bloodstream. When pancreatic cells become damaged or disrupted by a growing tumor, insulin production may decline. As a result, blood sugar levels begin to rise. For older adults who suddenly develop diabetes without typical risk factors such as obesity or family history, doctors may sometimes investigate whether pancreatic disease could be involved. Although most cases of diabetes are unrelated to cancer, a sudden unexplained change in blood sugar can occasionally be an important clue. And now we arrive at the final symptom, the one that many patients recall only after looking back at their experience. Number 7, extreme fatigue and weakness. One of the most commonly reported symptoms among people with pancreatic cancer is a profound and unusual fatigue. This is not simply feeling tired after a long day. It is a deep, persistent exhaustion that does not improve with rest. Patients often describe feeling physically drained, mentally foggy, and unable to maintain their normal energy levels. There are several reasons this may occur. Cancer can place significant metabolic stress on the body. It can alter hormone levels, increase inflammation, and redirect energy toward fighting disease rather than maintaining normal function. At the same time, poor digestion and reduced nutrient absorption may leave the body without the fuel it needs. When fatigue becomes overwhelming and persistent without a clear explanation, it is often the body's way of signaling that something deeper is affecting overall health. And for some individuals, this quiet symptom becomes the final clue that leads to a medical evaluation. The human body has an extraordinary ability to communicate when something is wrong. But these messages are often subtle. Pancreatic cancer rarely begins with dramatic symptoms. Instead, it often develops quietly, revealing itself through small changes that many people initially overlook. Persistent abdominal pain, unexplained weight loss, digestive discomfort, changes in stool, yellowing of the skin or eyes, sudden diabetes, and deep unexplained fatigue. Individually, these symptoms can have many possible causes. But when they appear together, persist over time, or feel unusual for your body, they deserve careful attention. because listening to the body's early warning signals can sometimes make a crucial difference in protecting long-term health. If you find clear, medically grounded explanations like this helpful for understanding how the body works and recognizing early warning signs of disease, consider subscribing to the channel. New videos are released regularly to help you stay informed, aware, and proactive about your health.